the PPT.
Just close the PPT so we can see you on a full screen.
Right.
Yes.
Able to see me?
Yes, doctor.
Yeah. So just watch this. This is the wrist. You have, everybody, you just watch it. You see this line over here? This line? Everybody will have this. This is like a broken necklace line. Okay? Why I'm telling you this is to identify where it is, how it looks exactly. This how it looks, it will be on the nape of your neck. This is exactly on the nape of your neck, you will find this. You can ask somebody else to just take the photo with a camera and they will be able to identify. This is the most simplest way of identifying that. So this is called as acanthosis nigricans. This is the first line that gives you information that your body is not using insulin properly. And it will be found on the nape of your neck, behind the hairline.
Should I go for the next question?
Yes, yes, please.
Okay. I have been a type 1 diabetic since the age of 11. I have been on a mix of insulin, and as part of the last 4 to 5 years, is it possible that my body is not responding to the insulin and has developed resistance over time since my HbA1c levels have gone high in the near past?
Okay. So one of the ways to look at your HbA1c, why if there is insulin resistance, is that actually we do what we call as the FIB4 score, FIB4 score, that is there to rule out early fatty liver. Okay, so there is an accumulation of, you check the cholesterol levels and then you do an ultrasound to look at the span of your liver size. So this is a way to tell you that your insulin is getting resisted. So the FIB4 score gives us an information that insulin resistance is happening within the body or not. And the most important, if you cannot do that, just take a simple measuring tape and you measure it around your abdominal girth to your navel point. And I said that will give you a wealth of an information that your fatty liver is there, and that is where the insulin resistance is happening. There is no actually a marker in the body to tell you, except for we use that C-peptide test which is there, and then we do the early morning fasting insulin. If the early morning fasting insulin is very high, then that suggests that insulin resistance is high. So these are the only ways by which we can be able to judge whether you have developed insulin resistance or not. But first and foremost, I think most important, obesity, especially more so the abdominal obesity, which can be done by a simple tape, and I think that will give you a wealth of information.
Thank you, doctor. Next question. Can you please suggest some healthy alternatives to sugar?
Yes. See, basically, none of the guidelines mention that artificial sweeteners are the best thing for you. Nowhere has been mentioned in the guidelines. In fact, they don't allow you to have take it, especially for the diabetes patients. What they say, that none of the guidelines say no sugars, no carbohydrate, no protein. They don't mention like that. They have always mentioned low fat diet, low protein diet, low carb diet. This is what they have mentioned. Now it is up to us what is comfortable for us to take, that is important. People consume jaggery, which is not written in the guidelines. People consume honey, which is not mentioned in the guidelines. So what is required is that artificial sweetness to be avoided, because these artificial sweetness contain a chemical reagent to keep the shelf life for long. That's why we can take it for 3 months, 6 months, or 1 year as per the expiry date. So these ingredients can cause pancreatic cells to be damaged. So that is the reason they are not recommending it. So what they are saying is that take everything in moderation. For example, if you take tea, coffee, in these old movies you would have seen that the chutki bar sindoor, so the chutki. So this much you can take in your tea and coffee at least in a month, in a week, twice or thrice. So you can just take direct sugar rather than taking the concentrated sugars. That can be avoided. You can take stevia. Now the plant extract which has come in, but there also there is some ingredient that is used to keep its shelf life. So that is important. You need to keep it in mind.
Next question is basic workout or exercises that can be done at home to prevent this.
Yeah, the simple exercise which I would recommend is simple amble walking, which you can do. You just have to first sit in the sunlight, and you can just tone your muscles first. Just straight away, don't go into any of the exercise. Don't run to the gyms. That's not going to help you at all. What is going to help you is how each body has been designed for a particular task. Your body is capable of working only for this much. Your organs have been designed to work only for this much time. So make sure that each one is different. One phase doesn't match with each other, so does the body. So what you need to understand, what is possible within your realm of doing it, which makes you feel very comfortable, you can do that. The best way to go about it is just simple walking. Just need to do 5 days and start with 5 minutes, and then go on to take 10 minutes, then 15 minutes in the morning and 15 minutes in the evening, and that is what is required. And yoga is the best thing to improve the circulation. This also you can do. And simple arm exercises, raising your arms up and down, and doing this front rowing and back rowing, even this will help you.
Doctor. How to deal with stress we often don't want, but it comes.
Yeah, this is the philosophical question, I'm sure, but I'm not any of the modern day gurus to guide you. But one thing I will tell you, you want to kill your stress, go to sleep. Then nothing better than that. You tire your body, go to sleep. The 7 hours of sleep is magical. I'm telling you, if you ever knew, because I'm a doctor, we learn through the physiology for 1 year, entirely understanding each organ and how it functions. So I'm telling you, if you knew how the mechanism in the night works is when you're on autopilot, you'll first thing get up in the morning and thank God for it, because that's a blessing. You need to understand that how the hormones are kept in harmony, which system is working, the automotive pilot system is working in the night, and that keeps everything under stable. It helps you to regenerate some of the cells, it helps you to remove the dead cells from the body. So this is so important. And the next most important is, if you're getting too much of stress, you need to divert your mind. You don't have to take stress all the time. If you're not able to do something, just leave it at that time itself, forget about it. Just come back to it again after half an hour, after relaxing, after diverting your mind, and then I'm sure the brain will work. It's like a super nap. Like, you're too tired, and suddenly you take a 10-15 minutes nap, and then you wake up and you see how you function well. So this is how the brain works. So at one time, don't confuse the brain that this has to be done, this has to be done. No, it's not like that. Let the brain relax, let the brain think, but give 7 hours of rest to it, and you see how wonders it works.
Please explain more on fatty liver, is another question.
What? I didn't get you.
Please explain more on fatty liver.
Fatty liver. See, basically, what is fatty liver is that you need to understand that fat, we all know what fat means. Okay, this is all lipids, this is all cholesterol. So, excess amount of fat is getting accumulated in your liver, in between the cells. Okay, so when this happens, what happens is, this is the chemical factory of the body. If too much of fat is getting laden into this fats, this in the liver, then the liver chemicals are not released properly. Then digestion doesn't happen. When digestion doesn't happen, then food micronutrients are not absorbed into the system, and the organs get weak. So over a period of time, this expansion of these fat cells within the liver, because of a poor dietary habits, because of eating excessive amount of oil, excess amount of consumption of oil, eating on wrong timings, overfeeding it, all these things will lead to, especially so with the bakery items and that fried and deep fried items, these can lead to more accumulation of the fat in your system and allow it to get accumulated in the liver. We are not worried when it is grade 1, because it has different stages. Grade 1, grade 2, grade 3, it can go up to that. The worry is that these cells do not replace again. It's like the brain cells. Once they're damaged for good. But if you don't allow them to reach to that level, for example, grade 1, it's okay. Grade 2, fine. Once it reaches grade 3, it reaches to a stage called as fibrosis. It is like a sponge. You know, when the sponge gets fire, and you see how hard and brown and dark it becomes, stiff. This is what happens to the liver. So we do measure the measurement of this to the fifth force score to understand the stiffness of the liver and then diagnose you whether you have developed fibrosis or not. So there are a lot of CT elasto, CT elasto scan of the abdomen of the liver is being done to understand how flexible the liver is not. So this is what it is. But over a period of time, it will lead you to develop pre-diabetes early because of insulin resistance. It will also lead to liver failure over a period of time. So we need to be worried about this, especially so with the children. So make sure that the oil consumption is very less.
Thank you, doctor. The next question is, what all fruits a diabetic can consume and when?
Yes. See, the best time to take the fruits is in the morning. That's what is the recommendation as per the guidelines is, but you can take it in any part of the day based on your feasibility, but not so in the night. So in the morning you can take, or by maximum you can take by the lunch. The fruits that are recommended are, the rule is only one fruit per day. You cannot mix fruits and take. And the fruit that are recommended, especially apple, you can take only half, not more than that. So you can take half apple, you can take one full pomegranate, you can take two full unripe guavas, you can take one full pear, you can take one orange, you can take one full mosambi, you can take one full kiwi. Three fruits contain good amount of sugar, like they also contain sucrose, mannose and maltose. So what you need to understand is that these need to be taken in less recommendation. For example, you have gone to the hotels to have this sambar and all this, idli, dosa, sambar, they give a sambar katori. So that much of consumption is there only for these particular fruits, especially watermelon, muskmelon and your papaya. They are very rich in sugars. You can take them, but the rule is in 24 hours only one time. Among the dried foods for diabetic patients, only three are recommended. One is almonds soaked overnight in the water and peeled off the skin by the next day, because it contains good amount of omega-3 fatty acids. Pistachios, all these are non-salted varieties. Pistachios, a fistful, you can take twice or thrice a week, and then you can take two walnuts every day. There's nothing better than that to to increase the omega-3 levels. So don't allow the cholesterol to stick to your vessels inside, and thereby reducing the risk of developing a cardiac event.
Thank you, doctor. The next question is, would it be really possible to reverse type 2?
Yeah, it is possible. There are a lot of studies done. There was a D-Tank study that was done, which was followed up for almost around 5 years. They had almost around more than 6,000 participants in it. But for a period of time, because of the strict behavioral modification in terms of diet, exercise, it was like, people were kept in a Shaolin temple and they were observed and they given a fixed pattern of waking up, fixed pattern of sleeping, fixed amount of exercises, and they never went on to increase the HbA1c levels. So they were, and there was a follow-up study also done. So lifestyle modification did definitely help them to, reduce this, or did not allow the HbA1c to go up or progress into the actual diabetes. But the possibility is there only when you see from the HbA1c being 5.2 to 5.7, but it's very difficult to diagnose unless and until we every year we do an HbA1c at least twice in a year to early screen. Now recently the Bio Blood Bank in UK have started a concept wherein every individual who goes there, they take their HbA1c and they call periodically once in 3 months. So this study has been going for almost around 5 years, and they found the benefit of this, that those who got themselves screened with HbA1c, knowing fully well through the family health tree that they were prone for diabetes, and so then they were able to identify the disease much earlier than the people who never got themselves tested.
What else should be added in multigrain flour apart from wheat, bajra, and ragi?
As per the research level, this has shown that these are the best combination. If you add anything beyond this, you cannot make the roti out of it, and you will be disturbing the balance.
Should be the ideal time for dinner to keep diabetes at bay? What are the recommended nutrition for dinner specifically?
I didn't get you, ma'am. Once again.
What should be the ideal time for dinner
Yeah, of course.
for a diabetic person, and what nutrition to be taken during dinner time?
See, basically, we always tell the patient that there's nothing like no carbs. They need to include carbs, but some people are habituated to take carbs. If they don't take carbs, they don't feel like they've eaten anything. So psychology, there's a barrier which they have. The recommendation is that, most importantly, all the medicine that have been designed for diabetic patients have been done on a 3-time meal pattern, like breakfast, which is a meal, lunch, which is a meal, and dinner, it's a meal. So they have been designed, they have been made to design in that way to work like that. So we need to match our food timings. So 8:30 is ideal to have your breakfast, and then you can 1:30 to 2 you can have your lunch, and then by 7:38 you can have your dinner. This is the earliest because the medicines work in that fashion. So you need to follow the timing. Otherwise, if you don't follow the timings, the medicine starts to work and there's no food in your stomach, and then definitely the medicines, after effects of the medicine by bringing the sugars low will take place. So balancing is very important, that you need to stick to your timing.
Doctor, is there a way to calculate insulin dose base the sugar values too? Can
Yeah.
we inject insulin anytime during the day or anytime like before or after meals?
No,
For
no,
how long insulin works?
see, basically, there are different patterns of insulin. We have short acting, we have intermediate, and we have long acting. So these are based on how your sugars have been erratic over a period of time. See, what you need to understand is that before meeting the doctor, always make sure that you have at least 3 days of recording. So that will give an insight into the fluctuation that happen. You just go to the doctor one time and show him that this is the value. It doesn't make sense. It is very difficult for him to make a modulation of that dial. And then the timings are important, as I said. So each insulin, so suppose the short-acting insulin will act for more than 2 to 4 hours. There are ultra-short-acting medicine that act for less than 1 hour's time. Then you have intermediate acting that will last for 16 to 18 hours. Then we have very long acting that acts for 24 hours. So it all depends upon which part of the time your sugars are fluctuating. The doctor will base it on that, and the units are decided based on your body weight. So 0.1 is what we take it as calculation per kg body weight is 0.1 unit per kg body weight. Sometimes for people who is not under control, we take it as 0.2. That's how it is.
Thank you, doctor. Next question is cardiac risk. Nowadays, getting news of heart failure in gym. How to take care of the heart?
See, ma'am, first and foremost, as I always tell you that don't anyway jump to any of the conclusions that that these things can happen to everybody. May not happen, may happen. But since this has been highlighted among the people who have been going to the gym regularly, we do not know what are the other conditions they were having earlier. It cannot just happen like that for a young and healthy people, just like that. Understandably, you're using certain medications. For most of these people who go to the gym, they use certain chemicals, like they use steroids, then they have so many other ketogenic, high caffeinated, this one, they have whey protein and all sort of things that are combination which take to increase the muscle mass. So I'm not too sure to tell you that exactly that everybody is going to develop like that, but unless and until you follow a particular time pattern and do it in a way that is required, which your body allows you to do it. Simple exercise is what is needed. You don't have to go to the gym, to prove yourself a point. Your body works differently, you need to work differently. So make sure that what makes you comfortable, which doesn't cause you harm, which doesn't injure your body part, and that's what is going to help you.
Actually, there are too many questions.
Yes.
Should
I'll
I?
take one last question because I have my outpatient waiting for me angrily. So give me one or two questions.
But I'm seeing this is never ending.
I know
I
we can
just-
have part 2 session on that because I have to evaluate on cardiac risk, how to identify cardiac events early, how you can prevent them from happening. Those are the things I will take it as a part 2 session. But now you give me 2 questions and I will take a shot.
They're asking medication is good or insulin is good. Need your advice.
See, basically, it depends upon which type of diabetes is it, and if your HbA1c under control and it's not costing more than 8.2, then you don't require diabetes. You don't require insulin. And see, where are the indications for using insulin that you need to understand? If it is a long-standing disease, See, as I told you, the pre-diabetic phase is missed. Some people will say, I just came to know only last year. Though, if you add the pre-diabetic phase, which is 6 years, it is 7 years of the burden of the disease they are carrying. And if you look at the HbA1c in the past history, which has never been in less than 7. So, and any complication that is setting into the system, rising HbA1c, complications getting setting in, and then OHA failure, wherein the medicines are, you started with 1 tablet, went on to 2 tablets, went on to 3 tablets, went on to 4 tablets. That speaks that you have already landed yourself into oral hypoglycemic agent failure. So there is no point in again continuing. When the towel is dry, you try to squeeze the towel, how will you get the water? If the towel is wet, you squeeze it, you will get that insulin. So that's what I want to explain to you, that make sure that you need to monitor your HbA1c, look for the complications. If the complications have been set in, it has cost more than 8.2, don't take a chance. Early insulin is going to what save you from developing complications. Insulin is not a bad thing. It's only the prejudiced mind. The problem is in India, type 2 diabetes. Look at the small children, type 1 diabetes. They have no other choice. They have to take it. For to diabetes mindset, not now, later, let me see, change the doctor, better the one who speaks good enough for him and makes him feel happy, no need of injections, take only tablet. That's what we are causing more harm. We are allowing the complication to come in early. And then he will be seen by 3 doctors, not 1 doctor, because he has to go and show for the complications. They are increasing the burden of the disease per se. And one more thing I would like to add before I close, most important, the testing which you all do. I'm still at a loss to understand most of the civilized countries in the world, not a single country in the world, in the civilized world, will do the test as you want it. Here I get people doing the test packages. Look at the packages: complete health checkup, complete body checkup, gold checkup, platinum checkup. What are all these abstract to do with you? You don't even understand the system. You don't know the value of your own blood. 10 ml of the blood which you give for getting yourself screened through your multiple there's companies which are sitting outside, give you a call and they come and collect the sample at home. You're not aware of what you're doing, what amount of damage you're doing to yourself, how low you're bringing your immunity. Nowhere in the world it is done like that. It's only in India you find these people. Just here to an ad, one wise person will take the entire family and get the blood shed. 10 ml takes 120 days. Imagine 6 ampoules you're giving without any consultation to the doctor. You have caused more harm to yourself. And during this time, if any virus gets into your system, any bacteria gets into your system, you have caused more damage than good. We come learning from the dead to the living. We understand your system. You ask us, take advice. It will save 2 things, your blood and your money. How many people know that when you come and see the doctor, you look at his degrees and find out, oh, what degree he has, how much international publications he has. When you go to the lab, do you ask them, are your machines new or old? Do you ask them whether the reagents which they're using are kept under controlled temperatures? The one who's coming and taking your sample, do you ask him, do you have a degree to do the test on me? You don't ask all that. Because it's just there, blood is coming. You don't understand the value. Blood is gold, my friend. Try to understand. Never ever do any test because you do not know what the specificity and sensitivity of each test is, which only the doctor can determine only after hearing you from your symptoms. Just don't go in front of the doctor telling that you're Dr. Google, you have had one fact and you searched everything. You cannot match the wit of the doctor because he comes learning from the dead to the living. You cannot even match 1 second of it. Forget about it. Whatever you're doing is out of your own ignorance and it's for your own detriment to your health. It's not going to helping you. It may save your time, but if you come to a doctor with a prejudiced mind with all this tests, and then suddenly you tell the doctor you look into all this tests, he has certain provisional diagnosis in his mind, he will keep his mouth shut. When he's done it, if I tell him to do this test again, then they will say this doctor is commercial. He's asking for more tests, but I already got this test done. You're not understanding. You're doing 22 tests for what? There's one particular lady who did all this. I'm asking that person, is your mother working in an asbestos factory? She said no. Then these tests have been done. Your mother sitting in a gold shop and blowing the smoke? She said no. Then this test has been done. There must be some rational, so much of irrationality, and we are suffering. People are not understanding why they're doing this. I always say, please consult the doctor first before doing any test. Don't do any of the packages. You do not know one exposure to the X-ray can be fatal to you. One exposure to unnecessary radiation can be fatal to you. So please make sure that first consult and then do it. Okay, ma'am?
Should I ask one more or I'll close it?
Yeah, close it, ma'am, because my patients are shouting at me.
Thank you so much, doctor.
My pleasure, ma'am.
Please drink your water.
Yeah, thank you.
It's
If any of the unanswered questions are there, you can forward it to Arif. I can send you a WhatsApp message.
Sure, doctor. I'm really privileged to have you. I will see if possible, we'll have one more session with you in the upcoming weeks.
Yes, we can talk more
I
on
really
Saturday.
appreciate your patience and time, and I hope that many of them have benefited and learned many more new things which we were neglecting or unaware of. Thank you so much on behalf of Global Insurance and all our clients. Thank you so much.
God bless you, ma'am. Thank you so much. Take care.
Thank you, sir.